Future of Patient Care Unfold. Dive into the Health Data Forum, where groundbreaking advancements and cutting-edge insights await. Explore the transformative power of data to revolutionize healthcare delivery and societal well-being. Join leading experts, thought leaders, and innovators as they delve into the latest trends and challenges. Experience the collaborative spirit of a vibrant community where ideas converge and partnerships flourish. Participate in discussions, share your perspectives, and contribute to shaping a healthier future. Stay ahead of the curve with our comprehensive video library, featuring insightful interviews and presentations. Catch up on thought-provoking conversations and engaging discussions that keep you informed. Together, let's harness the power of data to transform healthcare for the better. Join the Health Data Forum's mission to make healthcare data work for everyone.
Hello, everybody. Welcome to another interview on the Health Data Forum and Digital Health Portugal. We are going to stream live on both platforms, and it's really a pleasure for me to host today someone that I met at the Web Summit 2024 last month in the city of Lisbon, and it was a keynote speaker at this important summit. No less than the Atul Gupta, Chief Medical Officer of Diagnosis and Treatments at Philips. Atul, welcome to the show.
Thank you very much, Paula, and great to be here.
It's awesome that I had the chance to grab you for a few minutes on your busy schedule to share with us a little bit of not just what you talked about in the Web Summit, or reinforce the message that you wanted to deliver in the Web Summit. But first of all, let's talk about Atul Gupta, the medical doctor, the person. Can you introduce a little bit about yourself and what you do at Philips?
Sure, I'm happy to do so. And by the way, it was great. Wasn't Lisbon fantastic Web Summit? It's always an amazing meeting with all these brainy people coming in from all over the world. It was great to be able to speak about healthcare, which is, I think, the most important area in the world to talk about. And I can tell you a little bit about what I do as well. So my name is Atul Gupta. I'm a physician. I'm a practicing physician. I've been practicing for almost 25 years now. I live outside of Philadelphia, and I'm a diagnostic radiologist and an interventional radiologist. So what does that mean? It means I read X-rays and CAT scans and MRIs and ultrasounds to diagnose disease. But I also treat disease as an interventional radiologist. We do minimally invasive procedures, navigating little tools through your body using imaging to guide us, to treat blocked arteries, to kill cancers, to do all sorts of innovative procedures from head to toe. And that's what I do, and that's what I've done for 25 years.
That's amazing, Atul, because if we look at your LinkedIn profile, we see that you're pretty much in the field, and with the scrub and the mask. So how can you be able to still practice and have a role as a chief medical officer in a big multinational company as Philips? How can you handle this?
Well, it's a journey that started actually when I first started my career. Again, about the year 2000, and I was working in hospitals here in Philadelphia. But even early on, I wanted to work with industry, not work to get paid, but work to give them, tell them what the unmet needs are. What do we need as practicing physicians or nurses or technologists or hospitals, and co-create with them. And Philips, of course, was a very natural company to work with because Philips historically has always co-created. They work with us to help create technology. They don't just make technology and throw it out there and hope it sticks. And so I worked with Philips to say, we need ultrasound integration, and we need 3D road mapping, and we need 3D navigation tools, and all of these things that we needed to help increase and improve image-guided therapy, interventional procedures. And I unofficially worked with them over the years, with the teams in the Netherlands, where you also used to live, and also in the US. And then about, let's say 8 years ago, in about 2016, I joined Philips full-time. Philips also was going through a bit of a transition. As you know, Philips is a 130-plus-year-old company that started out in lighting, but really we've been in healthcare also for a century. And about 10 years ago, Philips pivoted to become a pure health technology company. And they needed to get some health people into the company. And I thought it would be a natural point in time for me to transition myself from clinical practice to working in industry, where I became Chief Medical Officer for the image-guided therapy business at Philips.
Oh, that's awesome. And so tell me a little bit about how do you see a company like yours having a stake at global health? Because I mean, we are thinking about a company that operates in multiple markets, right? So you are spread all over the world. Everybody knows.
Over 60,000 employees in over 70 countries. But that also makes it exciting. I mean, if you think about it, and it's one of the reasons I joined Philips, Paolo, actually. In my life as a physician, it's very gratifying. I can treat maybe 8 patients a day. And the first patient has a blocked artery in the leg. And in about an hour, I can open up that blocked artery. You can see the leg pink up. And the other patient has a cancer, and we can treat that cancer in about an hour. And another patient, they're bleeding to death from a car accident. We can stop that bleeding and watch the blood pressure come up. But I can only treat about 8 patients a day. Coming to Philips allows me to treat an infinite more number of patients. In fact, we put a number on it. We aim to improve the lives of 2.5 billion people a year by 2030. And that includes 400 million people in underserved countries. And that's what Philips wants to do. And so being able to have that kind of impact with healthcare, it was a no-brainer. It's one of the reasons I came.
Absolutely. But again, let me touch on this a little bit, because global health is such a challenging environment, and we see those poor countries where there are so huge need and demand, and such a scarcity of resources. So
not just poor countries, Paolo, even well-developed countries. I was in the UK 2 weeks ago. We know the challenges there. Certainly here in the US, also in Japan. I travel around the world. Portugal. 1.6 million people in Portugal do not have a general practitioner. So yeah, you're right. We have immense healthcare challenges all over the world. But the one thing I've noticed is wherever I go over the world, I hear the same exact 3 challenges everywhere. Let me tell you what they are. The first challenge I see, everywhere you go, patients are getting older. They're getting sicker. That's a great thing. People are getting older. But that also means that the workloads are intensifying for physicians, for staff. As I mentioned, Portugal is one of the oldest countries in the world, as you know.
Yeah, 800-year-old.
Well, but also your population is old. 25% of your population is now more than 65 years old. 25% of your population is over 65. In the UK, 500,000 people are over the age of 90. So well done, modern medicine. We've managed to make people older, but that also comes with baggage. They're sicker. That means disease is much more complex, and this is creating a bit of havoc for countries. So that's the first challenge. Patients are getting older and sicker. The second challenge, everywhere I go, every newspaper I open, we're talking about staff shortages. We're talking about waiting lists, burnout. Burnout amounts doctors, nurses, it's at an all-time high. 50% of physicians are now reporting burnout in the US. 65% of nurses. In the UK, 100,000 posts are now unfilled in the NHS. And in Portugal, you've had doctor strikes in the emergency department. Why are they striking? Because the physicians in the emergency department said no longer will they do 18-hour shifts. They will do a 12-hour shift. Now think about that. In any other industry, if you told people they have to work 12 hours, that's what they're, instead of 18 hours, this would be unheard of. But we have to do that because we have too many patients and not enough staff. So staff shortages is happening all over the world. We will not recruit our way out of this mess. We have to rely on digital health tools, things like AI and AR and robotics and automation, to help us combat the 15 million healthcare workers that we're short on by the end of this decade, which is only going to be in 6 years from now. So that's the second challenge. And the third challenge, I don't have to tell you, healthcare funds are shrinking. We're all being asked to do more with less. We have to be more efficient. So as I said, Paolo, I think that Philips, part of the most exciting part of my job is to be able to combat these 3 challenges in all these markets around the world using digital health tools, AI, AR, robotics, image-guided therapy, automation, telemedicine. These tools are going to be a very big part of the solution to get us out of this mess.
Absolutely. I could not concur more, and I'm sure our viewers also will subscribe to that view, Atul. But obviously, we have to be realistic, and we know that most of the challenges when we face digital transformation, especially in complex organizations as big hospitals, also have to do with people, resistance to change, willingness to change, right? So tell me a little bit, how prepared is Philips to support your customers on that part of the equation, right? Because it's not just giving you X amount of dollars for a new tech on the hospital, is right? So how are you prepared to assist your customers on that area?
You can't just throw money at the problem and hope it works. You can't throw technology. You're right. It's a mindset change, and you have to look at the problem from end to end. Let's take just one example: stroke. If we have a massive challenge in the world with stroke, it's a huge problem. It's almost as big as coronary artery disease, which we talk about all the time, heart disease. But actually, it's one of the leading, if not the leading, cause of disability in the world, and the number 2 cause of death. So to combat stroke, it's not just about doing procedures to remove the clot from the brain using minimally invasive procedures, which can actually reverse the stroke if you do it fast enough. And we've developed solutions, and we're continuing to develop the technology to speed that up so we can save neurons, stop the stroke. But it's also about the front end, before they get into the hospital, into the image-guided therapy room, meaning from the time that they're having a stroke in their bed. How do we develop the technology to get that patient to get to the ambulance in time, to get the ambulance workers to use digital health tools to diagnose them with an ischemic stroke in time, so that they know to take them to the proper hospital instead of the wrong hospital where they're equipped to handle it? By the way, how do we also then speed up the CAT scans and the MRIs? How do we also embed AI into those scanners so they can automatically detect whether or not there's a large vessel occlusion, where the clot is, and then activate the entire stroke network, meaning the neurologists and the nurses and the intensive care units and the interventionalists, shaving off even more time. And then how do we speed up the procedure in the room? And then after the procedure is over, when they finish with this successful stroke thrombectomy, how do we manage that patient at home with telehealth and digital health tools? All of this stuff working together is what's needed, not just little siloed approach to thinking. And that's what we do at Philips. We're looking at end to end across large clinical segments to see how we can diagnose, treat, and recover in a faster way.
Mm-hmm. That's amazing. You know, I've been in contact with Philips in different occasions as I visit some hospitals and here in Portugal, where I'm currently living right now in Madeira region. I was impressed to see that Philips has permanent resident staff to help large hospitals and support them on a daily basis. Is this part of your policy to be close to your customers? And expand a little bit on this, Atul, because it was surprising to me.
No. We have employees all over the world in over maybe 70 countries, and our employees, depending on the segment we're in, are very, very close to not just the physicians and the hospitals, but the patients. So, for instance, in image-guided therapy, which is these minimally invasive procedures that we do, it's not just the imaging, the interventional suites, the operating rooms that we build, and the software behind it that we build. It's also the devices that we navigate through your body to open up blocked arteries, like angioplasty balloons, or laser devices to open up these blocked arteries, or special wires that we put into the heart, or implants to prop open arteries in the leg. And those devices we also build. And that means that our sales force and our clinical force goes to the hospital to support the cases. They're there in the procedure room, wearing the scrubs and the mask and the hat, standing behind the physicians and the technologists, helping them and guiding them. So yeah, we have very close interactions and involvement with hospitals. We need to have that because that's the only way you can keep your proverbial fingers on the pulse of what's happening and also support. You can't help in healthcare from miles away. You have to physically see it, smell it, taste it, be there.
Absolutely, and this is I like the way you so vividly paint the picture of what's actually happening, and I can imagine your customers being satisfied with the support they get from Philips. But tell me, because before we starting this interview, we talked a little bit about how big companies like Google and Meta and Amazon want to go into the healthcare sector, and being Philips the example of a hospital-centric provider. How do you see the challenges in that space, Atul?
I think healthcare is too big. It's too important for any one company to go at it alone. And so this concept that one company is going to solve all the problems in healthcare, that's outdated in my mind. And that's why it's very important for me to not just co-create with physicians, co-create with hospitals, co-create with leading institutions all over the world, which I and we do, but we also have to bring into the conversation, I think, other companies, other healthcare companies, and other consumer technology companies. Let me give you one example. Augmented reality. I think we're just at the early stages of where AR is going to go. We, a few years ago, partnered with Microsoft. So when Microsoft was launching HoloLens 2, their augmented reality headset, at their announcement, which was actually in Barcelona, the world announcement with their CEO, they showed how HoloLens 2 was going to change the world with video games and data and construction. And the closing of it was, and by the way, you can also save lives with it. We developed a prototype with our Azorion image-guided therapy platform and HoloLens. And this was a partnership that we did with Microsoft, using their technology and our know-how in healthcare and our equipment in healthcare to tie the two together so we can use AR to do procedures, these minimally invasive procedures. And over time, we've also had similar conversations with a whole host of other companies, Apple and Meta and Microsoft and Amazon. So yes, I think that we must work together because healthcare is just too important if we don't.
Absolutely. And this is interesting because I'm glad that you mentioned the fact that there's going to be more and more a tendency for creating collaborative ecosystems among different suppliers that solve organizational and health problems to the governments, and obviously within the governments, hospitals are a main tool for delivering healthcare to the populations, and that's something that I'm also curious to know is how a company like Philips, which could be criticized to be hospital centric, right, can also contribute to healthcare and at a more system-wide level, right? What kind of things are you, current projects are you working with that can also bring us the power of health data to improve healthcare?
Well, part of it is just raising awareness. So you're right. It's not, there's a lot of stakeholders when it comes to healthcare, not just technology companies like Philips, healthcare companies, not just hospitals. More than that needs to happen. And so that's why, for instance, you need to have patients at the table. You need to have the payers at the table, the regulator at the table. You also need to have policymakers at the table. So going back to the stroke story, last year, Philips came together with another industry, Medtronic, to raise awareness about the importance of stroke and how we have tools now to treat stroke if only governments would invest in it. And this was done at the United Nations General Assembly. I was fortunate enough to be there with the president of the World Stroke Organization, and we had a number of countries in the room with us as we showed how much of a problem stroke is in the world. It's the #1 cause of disability, it's the #2 cause of death, and it's financially a massive cost to take care of people that have had a stroke for the decades of their life. Now we have tools where we can actually navigate a tiny little catheter, not much larger than a piece of spaghetti, into your brain, take out that little clot, which is not much bigger than a grain of rice. And if we do it in time, we can actually not just freeze the stroke, but reverse it, getting you back to normal. This is miraculous. Raising awareness to the payers so that they can see that if they would only fund stroke centers and stroke interventional centers, they could actually not only save patients, but save dollars that could be used for other healthcare initiatives is part of our goal. So yes, I interact with hospitals and physicians, but also I think increasingly governments have a huge role to play when it comes to healthcare.
Absolutely. And that's where evidence is needed. So the governments can have their policies adjusted to the real investments that can make a difference, right? Can you expand a little bit on the work you're doing with real world evidence on the technologies you provide and the projects are you working with?
Yeah, real world evidence is very important. So, we sort of have two flavors of clinical trials, as you very well know. I know you've done a lot of work in this space as well, Paolo. So randomized controlled trials, they are the gold standard when it comes to getting clinical evidence. And we certainly invest a lot in randomized controlled trials. So for example, intravascular ultrasound, IVUS, we call it. It's a little device that we navigate into your arteries and veins so that we can see what the artery looks like from the inside and see the plaque and see the wall of the vessel. And we do this in the arteries of the heart, we do this in the arteries of the leg and in the veins of the leg. Well, it requires evidence that we can present to regulators and payers and governments so they can reimburse this and create the guidelines. And so for IVUS, we have created a whole bunch of clinical evidence in the world of coronary artery disease, which has led to the classification of IVUS by the European Society of Cardiology at the highest level, class 1 level A evidence. So therefore now we see the adoption of IVUS going up because we've proven that it works. Or for instance, with stroke, we have a huge randomized controls trial taking place now that we call We Trust. As I mentioned before, with stroke, it's all about time. The clock is ticking. Every second that you have a stroke, every second that clot is in your brain, you're losing 2 million neurons. Every minute a stroke is in progress. So if we can shave off that time, we think that we can save brain cells. And so we actually have a trial underway to see if we bring patients directly into the interventional suite, where we have technology that can make a CAT scan without a CAT scanner, instead of going first to a CAT scanner, then transferring the patient to the interventional suite, would that not just save time, but can we quantify if it's improving outcomes? And this is a study that's called We Trust. It's a study that'll take place over the course of 15 different hospitals across 3 continents, including in Sevilla and Barcelona and Madrid in your area, 3 continents. And what we want to see is this going to improve outcomes? So that study is underway. So these are some randomized control trials. But I think, Paula, you were also asking about real world evidence as well, no?
Absolutely. How about data from actual use of technology, right?
I mean, randomized control trials, as you know, it's the gold standard. It's the way to get super evidence, but it takes time. It takes a lot of effort. It takes a lot of work, and it's needed. But, you know, as I said, the We Trust study is 500 patients, and it's taking us many years to get this. We now do studies like real-world evidence studies for IVUS that I had mentioned before, intravascular ultrasound. As I said, it's well studied in the heart, and we have 42,000 patient studies, randomized controlled trials that show its need in the heart and its benefit. But what about in the legs? That's been less clear, and therefore it's led to inconsistent adoption. So one example is in the largest ever real-world analysis of lower extremity leg IVUS, investigators at the Smith Center at Beth Israel Deaconess Medical Center, one of the Harvard hospitals, they studied 700,000 patients. And what they were able to do very quickly, using real-world evidence, using Medicare data, claims data, was they were able to show that when you use IVUS in the legs, it can reduce major events like amputation by 30%. So it's another example of a faster way to get evidence using, and we have access to big data, we have AI. So we have so much, if we can just tap into this real world evidence, the insurance claims data, the electronic medical records, wearable data, it will shorten the path to evidence and therefore increase adoption and utilization in my mind.
Mm-hmm. Absolutely. I mean, this conversation could go for hours, but of course, I'm minded of time, and we need to get close to the end of this wonderful conversation. But before we go, Atul, I would like to ask you a question, because since we are in this particular season's holiday season, and if you had a magic wand in your hands, what would be your key wishes? I don't put a number, but what will be your key wishes for 2025?
I'm actually very optimistic on the future, and I'm actually very optimistic on the future even next year. I think if you look at AI has largely been talked about for the past 10 years, and it's led to a degree of skepticism. A lot of promises were made, a lot of hopes were placed in AI, but we were not seeing a lot of AI happen in the world of healthcare until this past year. And I think we're starting to see the tipping point, the acceleration of tools in AI that are actually making a difference today. I can give you examples. I talked about how we already have AI embedded into our CAT scanner so we can see clots in brains and rapidly activate a stroke center. I can already give you examples how we're putting AI in our ultrasounds so we can rapidly detect whether or not your heart is at risk of failing before you have any clinical symptoms. In other words, preventing the disease. We have AI embedded into patches now that we can put on your skin if you're having an irregular beating heart, and we can predict whether or not you're going to have complications down the road. So I'm very optimistic about digital health tools like AI, NAR, robotics, and automation. Next year, I think that we're going to be poised to having treating patients faster, diagnosing patients faster, predicting and preventing disease, and increasing access to care. Increasing access to care in places of the world where they do not have access to care. It's ultimately our goal to give the same care, the best care, no matter where you live. So I'm excited about 2025. Stay tuned. I think the future is awfully bright, Paolo.
Thank you so much, Atul, for this wonderful conversation. I think our viewers also learned a lot, as much as I did, from what Philips is doing and the prospects for a better healthcare future, thanks to the technological developments and the good news is that policymakers, you are going to change because evidence is going to point you in the right directions for the right decisions. That's for sure.
Here's
Atul,
to a safe, healthy, and happy new year to everybody.
Thank you so much, Atul, for your presence here with us. And dear viewers, same to you, season's greetings and Happy New Year according to the time we're going to listen to this video cast. Thank you so much. Thank you for watching.
What if you could be part of a revolution that transforms healthcare as we know it? Welcome to Digital Health Portugal, where innovation meets collaboration. Our mission is to foster the transformation of healthcare systems by promoting open dialogue, civic engagement, and the adoption of innovative technologies. Imagine a world where patient outcomes are optimized and healthcare delivery is seamless. Our Digital Health Manifesto is the strategic framework guiding this transformation. Our events, seminars, and workshops create momentum for sharing and discussing health-related ideas. Experience the power of collaboration at our quarterly meetups. Portugal's thriving startup ecosystem is reshaping the digital health industry. Our products and services are uniquely created to match your communication goals. We are the most relevant civic engagement platform for health innovators. We partner with Forum Hospital do Futuro to foster a sustainable national health service. Our think tank, SNS de Contas Certas, is committed to driving the transformation of the National Health Service through open dialogue among public, private, and social sector stakeholders. We encourage knowledge generation and support policymakers in understanding health ecosystem needs. Be part of the movement, advocate for change, and co-create the future of healthcare. Our members are united by a shared purpose to drive meaningful innovation and transformation in healthcare for the benefit of all. Dive into our podcast to uncover actionable strategies from our think tank plenaries. Join our LinkedIn Live sessions for engaging discussions with healthcare leaders and innovators. Join us at the Health Data Forum Global Hybrid Summit to shape the future of health data. Our goal is to raise the excellence of the Portuguese healthcare ecosystem internationally. Be part of the digital health revolution with Digital Health Portugal and make your mark.